Good morning. Good morning, everyone. Thank you for being here. I'm happy to be joined by Dr. Alvin Jackson, our Director of the Department of Health, by George Maier, our Assistant Director of Public Safety, and by our Attorney General, Richard Cordray. Pain medication, when abused, ceases to treat pain and instead causes it. When abused, it ceases to heal and instead ruptures families and communities. Too many lives have been lost. Too many people have become lost chasing these pills. Prescription drug abuse is a menace that must be fought with every available tool. So today we are creating a new tool to help us take on this public health emergency. The Drug Enforcement Agency administration estimates that the abuse of prescription drugs nationwide has increased by 80% over the last decade. Over the last decade, the number of Ohioans dying from drug poisoning has quadrupled. Today, more Ohioans die from drug poisoning than from motor vehicle accidents or any other kind of injury caused death. And prescription drug abuse is by far the leading cause of drug poisoning. Southern Ohio, including my home county of Scioto, has suffered from the highest rate of prescription drug abuse and death in the state. The Federal Drug Enforcement Administration has placed Scioto County on its watch list of the 10 areas across the nation with the most serious prescription drug abuse problem. Recently, the sheriff of Adams County had to ship prisoners out of the county jail to make room for dozens of people caught up in the prescription drug sting. Prescription drug abuse is made possible by several different actors who are indifferent or worse to the cumulative effect of their behavior and others like them. One of the deaths in Adams County last year is typical. This man had been to 5 different doctors in a 7-week period of time. He received 312 prescription pain pills. He took those prescriptions to be filled at different pharmacies, including one that was 170 miles from his home. And then he died. He died sitting in his living room, his system racked with the damage of prescription drug abuse. Much of this abuse is being fed by pill mills, where prescriptions and pills are dispensed in exchange for cash. No insurance coverage, no credit cards, only cash. And so to all the pill mills out there, and I hope some of them are paying attention today, to all of those pill mills making a profit by selling a poison, let me be clear. We are coming after you. What you do is illegal and it is immoral. And we will fight you with every tool at our disposal. Now, pain management is a legitimate medical concern, and there are noble, highly trained, highly ethical physicians providing much needed medical care to those who are legitimately in need of their care. And we honor those physicians, and I want to make it very clear that what we're talking about today is not legitimate medical treatment. What we're talking about is an immoral and ethical profit-making system that takes advantage of people. We don't want to interfere in any way with necessary medical responses to chronic pain. But there is no place for a physician or a pharmacist who are not meeting acceptable standards of care and who are apparently dispensing prescriptions not as a means to help a patient, but as a means to enrich themselves. Ohio needs, I believe, a more comprehensive and a more coordinated approach to combat prescription drug abuse. And today I'm establishing the Ohio Prescription Drug Abuse Task Force to assist law enforcement, public health officials, and lawmakers in our efforts to protect Ohioans from the scourge of prescription drug abuse. And I will sign that executive order at this point.